Man, presented by the Riverside Animal Hospital and Dr. Dan Drehas. Dr. Dan will discuss various aspects of the animal kingdom and how you should care for your pets. If you have a topic that you'd like Dr. Dan to address or a question you'd like to have answered, just call KWPC studio line at 263-8600 to participate. Please understand that the views and opinions expressed by the participants of the program are not necessarily those of the management, employees, or advertisers of this radio station. And now it's time to find out what's in store for us today. From Dr. Dan Drehas, Dr. Dan the Animal Man, brought to you by the Riverside Animal Hospital in Muscatine.
Good morning, Muscatine and the surrounding areas. It's not negative 130 below zero today, so you don't need to snuggle up to your phone, or sorry, to your, well, I guess you can do phone app, your radio, your whatever, and listening to Dr. Dan the Animal Man, coming to you from Riverside Animal Hospital, your dental laser surgery center. And interesting, I was listening to you moving forward this morning. I've been in practice since 1993, so was that 26 years, yep. Something like that. I never knew that our National Pet Health Month was the same as National Children's Health Dental Month. So clean your children's bright smiles and your furry children's smiles in the same month. Where have I been? I feel like a new man.
There's so many opportunities there.
There is. When you're dropping your dog off to check the teeth out, you can go get your two-legged child with no hair, furry, whatever teeth, and then come pick up your furried one, four-legged one. So
make sure you drop them off at the right place, though.
Yeah, if you cross them over, there'll be a lot of confusion. I think we may end up with a better deal, us veterinarians. I'm going to expand on that a little bit. I know I talked about Dental Health Month in January, kind of leading up to that. And then if you tune in 2 weeks ago, we were talking about emergencies and care and stuff like that because we had a lot of cold emergencies that week. But I want to finish up the month kind of almost like the final chapter on the National Pet Dental Health Month, which is February, like your children. And I just went to the Iowa Vet Med Association conference last Wednesday, and I spent some time in their dental. There's a whole seminars all day long on dental health care and new techniques and new thoughts and what's new in your pet's teeth. So it works out as a nice little apropos continuing education moment for us. So give us a call, 263-8600, or text Jordan. He'll pass that along to me. It's been a long while since we had a call, so let's hear one today. I got high hopes because of warm weather. People, well, I shouldn't say warmer weather, warmer than negatives. Well, I guess it depends on when your wind chill is happening. And it doesn't have to be about dental health much. Just what's on your mind, what's been bugging you, and you want a free opinion on the air. And you'll get your money's worth. It's a free opinion. So anyway, Dental Health Month. I was listening to, like I say, to moving forward, and I'm going to expand on one thing that you were talking about because you said doesn't have some, the bacteria, you swallowing it and gets into your system. And I don't know if that young lady was she a doctor? Was she was actually, they refer to dentals. So yes. Anyway, she may not have the medical background. So I'm going to expand a little bit on the human aspect. Now, I'm not a human doctor, but I can only imagine the similarities. And actually, the bacteria you don't swallow, it actually gets right into the bone, and it absorbs locally. So you're eating all kinds of bacteria, and your stomach acid will take care of that. So it actually absorbs right into your bone and your teeth because there's blood supply, bleeding gums. Guess what? Bacteria goes right into the blood system. And so dental disease, infection in the mouth, it's not so much swallowing the tartar, it just absorbs right there, gets into your blood system, goes to 3 primary organs that cause disease. And we probably do as much research, in fact, maybe more research in the animals than in the humans on where that goes to in our species. So heart is one of them. And actually, instead of clogging the arteries, there's something called vegetative valvular endocarditis. Big word, makes me sound smart and like I got my degree. But what that is that bacteria in your heart valves that are flipping, flapping back and forth, the bacteria from your teeth lodge on those areas. and it causes the valves not to close very well. Vegetative valvular means something's growing, like vegetables, which is bacteria, from your teeth on your heart valves, and that causes endocarditis and heart attacks and different things. So at least in our animal profession, it's been very well documented, pigs especially, and then even in the small animals. So we at least know that's where a lot of that vegetative valvular endocarditis, which is heart disease, comes from. Now, so I'm assuming that's what happens with humans too. So the other two areas, because that bacteria is floating around in the body, is in your kidneys, because those small kidneys are filtering stuff. It gets in kidney disease, and of course your liver. That's your other filtering system too. So you get liver disease, which is very well proven, kidney disease, which is very well proven, and then the heart disease on those valves, which is very well proven. So the bacteria from the mouth directly into the bone and the blood system there, and of course then you just get bone infections, which is alone, I guess, it's an organ. It's your bone. It's not your teeth. It's actually a bone infection, and but the biggest difference between humans and animal kingdom is humans, we get cavities, and you said, painful cavities. Now, both species get root abscesses. We've had tooth abscesses, so that's very similar. But dogs and cats don't get cavities, so we don't do the fillings and cavities per se. We have much more of a problem called periodontal disease, which we get in the humans, but brushing, we take care of that a little bit better than the dogs, which don't brush. And that's our biggest nemesis in the animal profession, is that infection along the gum line, which releases that bacteria I talked about. But more importantly, it burrows away at the connective tissue, the periodontum, which is your ligament that attaches your bone to the tooth, and then it starts eroding the bone, eroding the gum, and all that stuff. So now you got a tooth that's not even hardly attached, it's wiggly, and the infection's going in there, and we got a tooth that's painful, and then we have to take it out. So we do a lot of periodontal disease control and extractions from that, but not cavities. It's just cats, not at all. Dogs, pretty rarely have it. The cats have their own unique disease called resorptive lesions. It's kind of like cavities, but not, in the fact that the enamel gets eroded, but it's actually a much more complex disease, and we don't know what causes it. And that's another one that we have. So we have our own little issues, still dental disease, which is, I still think it's the number one behind obesity, or they're close. But disease is really that can cause major issues in animals. So it's the number one. There's been all kinds of studies, and one of the things I saw down there, and I should have wrote these things down and brought with me, but depending on which place is doing the statistics, but basically 75 to 100% of dogs and cats over 3 years old have some level of dental disease. They don't take that toothbrush on their own in their little paws and brush their teeth. We can certainly help out with that. Excuse me. So that's the deal with which dental disease we're talking about. And yes, it can, one, lower their life expectancy with those three: heart disease, liver disease, and kidney disease. And yes, they're not so fun to kiss and let them lick your face when they have a stinky yuck mouth, we call that. And the third thing, which is, I don't know how they did this study. This is the difficult part. But the first time I heard at this meeting last week was that dogs and cats definitely feel the same pain in the mouth as us humans in the mouth. So if you're out there, if you've ever had a toothache, and that's usually from, abscess or something, but a toothache, dogs and cats feel the same thing. The only difference, they don't show it like you and I do. They don't complain, and hold their paw over the mouth. They don't cry out in pain. Yes, sometimes they'll chew, and some of the subtle signs we show. And now, here's your 2 seconds to take a look at your cat or dog at home. Lift up those gums, and don't just look at the front teeth. It's the back teeth that we worry about. And if you see any redness, any smell, any tartar on there, you have disease. And then start thinking about some of the subtle clinical signs of maybe dropping food when they're eating, taking a little bit longer to eat than they used to, maybe losing some weight, maybe some drooling, maybe swallowing it whole a little more than just actually spending the time chewing it. Maybe they're grumpy. They're just a little more grumpy than normal. Maybe when Dr. Dan told you to lift up their gum and take a look, they snapped at you and didn't want you to look at their teeth. And I see that a lot when the owner says, maybe they don't even know there's a problem. But I always we as veterinarians, that's part of the annual exam. We lift up their gum, look at the teeth, and if they growl at us or snap at us, that may be an indication, and then we can see some redness. And I'll tell you, once we convince that owner that, it's a good thing to clean those teeth, deal with those, we find the problem, and then we extract the tooth, and then all of a sudden that's a much happier cat or dog, and they're not nipping at you, and they're eating their food better. And I will tell you, almost across the board, whether that's 1 tooth, 10 tooth, or 32 teeth, that's a whole mouth extraction. If we take a bunch of teeth out of there, some cats we have to do that for some diseases. Not that many, but, I've easily taken 16, 20 teeth out of animals at one sitting. And owners go, oh, my gosh, Dr. Dan, that had to be painful. I'm like, it was very painful to start with. But across the board, like I was going to say, they come back 2-3 weeks later after the thing's healed up, and they say, oh, my gosh, it's a different animal. They are so more loving. They eat much better even without those teeth. And it's surprising, folks. They can have no chewing teeth in their mouth, and they will eat the hard food better than when they had the teeth before I took it out. It's surprising.
How does that work?
They have a nice hard palate. They'll chew on,
Really?
they'll chew on. Yeah, I wonder about that too. But yeah, they still. I have plenty of cats with no chewing teeth. They have some incisors or maybe some canine teeth, but we have to take out the back ones from some diseases like stomatitis or this resorptive lesions I was telling you about. We take out all their chewing teeth because it's kind of infectious, so to speak. It spreads. So I take them all out. And they come back and they tell me, you know what? We gave it soft food right afterwards, like you talked to us, so it can heal those, the gums after we pull those teeth. But my cat prefers hard food. I put the hard food down, he chews it, and he leaves the soft food alone. I get that a lot. I don't know why that is, but they do. So it's kind of surprising.
It is.
But it's good. It's okay. They eat better. That's what we look at. They're happier. They're not as grumpy. And if I had a nickel for every time a cat came in and I touched a tooth, and those are painful, by the way. The resorptive lesions, which are kind of similar to cavities, but I show the owner when they come in, and all it looks like is a little gingivitis, a little red gum line. Doesn't look like nothing. How about that for a double negative? It doesn't look like anything. It looks like nothing. But when I touch it with my finger or like the ballpoint pen or something like that, something round, and the cat will, if you're watching it on the video and go to YouTube, it opens up its mouth and almost like and you can tell, wow, that hurts, and it shows the owner, if it's doing that with a pen, what is it doing? Why it won't play with this ball anymore? Why it won't fetch and chew on catnip? Why it won't eat out of that side of the mouth? Why it won't let you pet you in the mouth? That's the reason why. And most recent one I did, that's the way it was. I couldn't look in the mouth on the one side specifically, and we found that had more of them than the other side. Which comes to my next topic. In fact, let's take a break, and I'm going to talk about my dental x-rays and some more funness I've been finding. So we'll be back in a minute. This is Dr. Dan, the Animal Man.
Are you missing a tooth and wish you could have it back? Or do you have loose dentures or loose partial dentures? An implant can get your missing tooth back, and you can brush and floss like any other tooth. Implants can also help your dentures or partial dentures fit securely without the goo. Gentle Family Dentist is the only dental office in Muscatine with 3D cone beam combined with CEREC technology, where they can design a beautiful new tooth in your missing space. Call Gentle Family Dentist today if you would like to see if you are a good candidate for an implant, and they will take a 3D cone beam for free, a $375 value. Call them today.
Here's a look at your forecast from the KWPC, AM 860 and FM 95.1 Weather Center. A winter weather advisory is in effect for the area for tonight and during the day on Wednesday. In the meantime, we'll see more cloud cover in the area today with a high at around 27. For tonight, light snow develops and some mixed precip in spots, low in the mid-20s. Now we'll see light snow or mixed precip turn to a few rain showers Wednesday, high in the mid-30s, with 2 to 4 inch snow totals. I'm weatherology meteorologist Paul Trombley. Right now, 4 above.
Welcome back to Dr. Dan, the Animal Man, presented by the Riverside Animal Hospital and Dr. Dan Drehas. Please understand that the views and opinions expressed by the participants of the program are not necessarily those of the management, employees, or advertisers of this radio station. The number to call is 263-8600. And now, back to Dr. Dan, the Animal Man.
We are back. This is Dr. Dan, the Dental Man, as far as for vets anyway, for your animals anyway. And we got about 10 minutes left. I got to get back to do a dental, as a matter of fact. But I want to end up with talking about the dental procedure itself, and then if there's any quick little questions. Again, 263-8600. And the other big difference, at least in the dental cleaning with the humans versus the animals, is the process. Unfortunately, when I go get my teeth cleaned, I sit comfortably in a chair. The dentist says, or actually the hygienist says, turn your head this way, swallow, move this way. Can you do that? Can you move your tongue out of the way? Dogs don't listen very well. Neither do cats. So we have to actually anesthetize them. So that adds an expense to that, which fortunately for us humans, we don't have to have that. So the routine cleaning certainly can be a little more expensive than the human aspect, because they can get done in 15 minutes and you're up and down, and they can get the next one in and go right off the bat. Where we have to clean up the anesthetic, and we have to induce. We have to, it's a longer process. So I don't know what a dental cleaning is these days for humans, of 50 to 150 or something like that. It depends on where you're going to. But dental cleaning in a dog or cat can range, between $150 and $300, depending on the size of the animal. And then of course, it depends on the other end of it, where if we have to extract, it's expensive for the dogs and cats, but way more expensive than humans to now do some, cavities and dental fillings and stuff like that. One thing we've certainly added, and I'm doing more and more. In fact, I'm requiring it on everyone, and I briefly mentioned it about a month ago, the dental x-rays. We do have digital dental x-rays at Riverside now, and I love it. Woo! I'm finding out things that I did not know was happening in the past. Even the one I just did Friday, dog came in and we cleaned the teeth, looked pretty good. We did the dental x-rays, and I found 3 teeth that were what I talked about, periodontal disease, looked good on the gum line. It had a little bit of a pocket, but when we took the x-rays, it was like 40 to 50% of that tooth was already detached and going away. And so we discovered some things on the dental x-rays we would have never known otherwise. So we extracted those teeth. We showed the dental x-rays to the owner, saying, hey, this was actually worse than what I could tell in the exam room, because you can't look below the gum line, just like in the humans. You can't tell. And when I found a little abscess on there, so we had to take that one out. So dental x-rays are fantastic. We've added those on, and I, at this meeting, I found out that the national average for dental x-rays on a dog is $60, and we only charge $36. So we're much less than the national average, but I want to make sure we do that so we can find those things. So that's dog or cat. We'll do a full series and look at the upper and the lower and the front and the back and stuff like that, and gain that information. So yeah, a dental, if you start taking out those 1920, they can be, $900 for a really bad one, maybe $450 or so for, I think that one that I took about 5 or 6 was about $370 or $380 with our dental month discount, which is 10% right now, folks, for the end of the month. If you get in and get your estimate or give us a call, get that scheduled, we'll still kind of continue that into March. So Riverside does have the dental month discount celebrating the month, and that's 10% off on everything we do underneath there, except for the blood work, which we hope you do ahead of time. So anyway, if there's any questions the last few minutes.
I actually have one. We talked a few seconds. Yeah, we talked about it before. What you recommend for people to do for their pets, for their teeth, like what they should chew on. Now you talked
preventative.
About,
okay.
You talked about chewing on hard stuff versus chewing on something soft, and
yep. Yeah. And I talked to the appointment I saw first thing this morning. They had a broken tooth, and they said there's swelling on it, and there was a big old Labrador, and that had a tooth thread abscess. So we're gonna clean those teeth, take an X-ray, see which tooth it is, and deal with that down the road. But it depends on what you're chewing on. Now that dog, I asked the right questions. I certainly avoid things like the hard things. Dogs love to chew on rocks. Not good. Not that we're giving them rocks to chew on, but things that are kind of similar to that, or that we don't think may be similar. Those ham bones. They get on those and they chew the heck out of those, but they're hard. If they can pound in a finishing nail, I remember telling you that one, that's probably too hard for your dog's teeth. Pig ears and cow hooves, they love them. They stink. They chew, but that little round area where the canal is of the pig ear, that's very hard. The tops of the ears are okay. They're all hides. That actually is pretty good because they scrape down the gum line. But that hard part where the ear canal is, that's hard enough they can get their tooth into a little crack in there and bite down and snap off a tooth. Sticks are actually okay if they chew on them every once in a while because they're not that hard. I do not like some of those over-the-counter the real hard long bones that you see, and they look like they're basted and they have all kinds of meaty yumminess to that, but they're hard. And the dogs will chew the heck out of those and then they'll crack a tooth. So I like to avoid those really hard bones that you see over the counter. Of course, there's a lot of good commercial stuff. Everybody's heard of Greenies. Very good. They are approved by the, and I mentioned this website before, the VOHC, the Veterinary Oral Health Care. We have a link on our website. Go to riversidevet.com. A link on the VOHC, and it'll show a whole list of approved things that do and have been studied to reduce tartar in the mouth. There are some diets out there. There's Greenies. There's what we call CET chews, which we sell, which not only do they chew and scrape their teeth, but actually have like a scope in there to kill the bacteria that we talked about. It's a nice double hit.
You say scope a lot. What's the scope?
Well, human scope. You think of whatever Listerine mouthwash scope.
I got you.
Sorry, I'm using product placement, but mouthwash. That disinfects your mouth to kill the bacteria that cause bad breath. Everybody's seen those commercials. We put those same things in chews because, of course, you're not going to have a dog gargle.
Right.
So we infuse some of our chew things with those antibacterial so that they're disinfect their mouth that causes bad breath and bacteria. So let's hit the double whammy. Let's scrape those teeth with something good that chews down and disinfect that mouth. So those are some great ideas and great things to use for your mouth. Of course, brushing is the number one thing, which takes time. And we do have a number of clients out there that, as puppies, they taught them how to brush their teeth, and they can do that. Fantastic. Again, I talk about some diets out there have actually some infusion into them. Royal Canin, IAMS, the Eukanuba, used to be Eukanuba, now it's all IAMS. They were kind of the same company. They coat their food with something called hexametaphosphate. There's a big one. And I see some chew toys and treats that have this hexametaphosphate, HMP. And that actually takes the calcium out of their mouth, which causes the tartar, and they swallow it. So your saliva has calcium salts in it. So as they're chewing on these things, the saliva is in their mouth and it's pulling the calcium so it doesn't cause a tartar, so it reduces tartar. Because tartar is plaque, which is your bacteria and your cells and all that kind of juicy stuff. And then your saliva has the calcium in it, and when the saliva comes down, it takes that plaque, and after 24 hours, turns it into tartar. Or calculus. Gotcha. So that's why they say brush every 24 hours at least. So it's preventing that 24-hour contact time to turn your plaque, which is soft, into your calculus or tartar. So that's the difference. So brush twice a day or 3 times a day, you're preventing that 24-hour plaque build up into the tartar. So
Gotcha.
So that's why the timing is important. Or give them a rawhide, or give them a chew toy, or give them something once a day, or those greenies or whatever once a day to prevent that 24-hour contact time that your saliva needs to do that. So that's those are very good things. There's some water additives that can help reduce the tartar in the mouth, again, by slowing down the bacteria, akin to the mouthwash sort of a thing. There are some rinses that I say that we don't make mouthwashes, Listerine, Scope, whatever, but there actually is one called chlorhexidine, and you can actually, if you see those football players, they have the little hook water bottles that they hook in their mouth and whoosh their mouth out. It's the same sort of thing. You hook it in their mouth and you give it a little squirt, and then let their tongue whoosh it around. So that can be helpful too. Do not give them gum. Sugar-free, we talk about toxicity, so make sure you stay away from that. But I'm trying to think of some of the other things. I think those are probably the biggest things that, as far as helping them out. Now, if you are going to give them greenies, rawhides, those chewy sort of things, we always say watch them carefully for the first several times you give those products to your dog. Now, this is very important. I'll say it again. If you are going to just run out there because you heard Dr. Dan say, he said rawhides and greenies and stuff like that, watch them, again, the first time or for several times you give that, on making sure they're actually chewing it and taking the time. Because if they say, oh, a greenie, oh, a CET chew, oh, whatever, you name it, oh, a rawhide, and they swallow it down whole in one bite, no. One, you're not cleaning the teeth. They're just swallowing it because they're gulpers and swallowers. 2, you can potentially cause a blockage in the stomach. So they actually have to chew on it and bite off pieces and chew on it and take some time so it can scrape those teeth, get that mechanical action, and not cause some GI obstructions. Now, knock on wood, I've never seen one in my 6 years career. Again, that's knock on wood. It does happen. So it is a potential. The chances are very, very small, and we reduce that by being good observation sort of owners. So that being said, keep those children teeth clean this month with their National Children. Keep those furry children with your National Pet Dental Care Month. And we will see you the first next month. This is Dr. Dan, the Animal Man.